Hi, everyone. My name's Ray Thomas. I am the Research Education Lead for the Tropical Australian Academic Health Centre up in Northern Queensland. So welcome to our TAAHC Prac today. It is on questionnaire design, as you can well see. And we're going to be treated to 1.5 hours of understanding how to do questionnaire design. And this is interactive. This is an interactive session. So what we're going to ask you guys to do is, do you have your mobile phones? We have 3 ways you can interact with us. One of the ways you can interact with us is to use your mobile phone, okay, and scan some QR codes. The second way you can interact with us is Michael has put in the chat a link to a Microsoft Forms that has the questions in it. Now, all the questions will come up at once, but you only answer when we ask you to answer. You don't feel free to sort of answer 30 questions all at once. You don't need to. But that's another way that you can answer. And then perhaps my preferred way for you to answer, stick up your hand and say something, and that'd be really great. So that's how we're going to run today. But before we run today, I just got a couple of things I want to talk about. First of all, I would like to acknowledge the traditional custodians on the land on which we all gather. For us, we want to say that we recognise the First Nation people and communities as traditional and cultural custodians of the land on which we live and work, and we pay our respects to elders, past, present, and emerging. So just before we get going, then, just a little bit about TAAHC, potentially for those of you who do not know about TAAHC. We're a collaboration in Northern Queensland between the 5 Northern Queensland HHSs, so Mackay, Cairns, Torres and Cape, Townsville and Northwest. We are also a collaboration with NQPHN, Primary Health Network, the Queensland Aboriginal and Islander Health Council, and James Cook University. And our remit is to enable a research culture for all of our TAAHC training partners and for other people in Queensland as well, and nationwide if you so choose to join these sessions. Some of the things that we offer, but these are only for our TAAHC partners. We do research and research translation training and coaching and mentoring. We do study design and support. We have statistical consultations and analyses with our more than capable person today, Micheal Crowe, and we also offer some grant funding. And if you need any further information about us, there's our TAAHC website. Go and have a look. Bearing in mind, we are in the process of making it even fancier. So go and have a look at that. But before we present today, this is my very last slide. We're going to be talking to Micheal Crowe. He is a TAAHC statistician, and we have a service called the Study Design, Epidemiology and Biostatistics Support Service, fondly known as SEBS. And Michael's going to spend some time today talking about how to design a research questionnaire that won't drive people crazy. So without any further ado, I'm going to let Micheal share his screen, and over we go.
It should be starting to share with any luck.
It is sharing. It's perfect.
It is sharing. So good. My name is Micheal Crowe. So with TAAHC as a stats and research methods help for if you need it. So I'm going to go into this. There is a little bit of content here. So if at any stage you want to interrupt me, please feel free to tell me to shut up and listen. I'm happy for you to do that because, as Ray said, this is more about you than me, and I can talk about this stuff ad nauseum for hours, I imagine, if you let me to. So if you, just interrupt me and say what you need to say, that'll be good too. Let's move along then. So the aim today then is to look at exploring the principles of questionnaire design. Talking to people during the week, I realized that people use questionnaire and survey interchangeably as words. So in everyday language, we kind of say, oh, I'm doing a survey or I'm doing a questionnaire or whatever. But from a research point of view, a survey is a particular type of research. that involves things like having a research question or trying to solve a problem, deciding about sampling and analysis and all of those sort of things. So it's kind of a very broad thing, whereas a questionnaire is simply a way of collecting data. And it can be used in any research method. Questionnaires are used quite broadly just to collect data rather than necessarily doing a survey as such. So for example, a survey could be how many cars are parked in a car park and what are their makes and models. And it's very, very hard to ask cars questions. They don't tend to answer too much. Give it another couple of years and they probably will answer back, but that's a different matter. Whereas often in things like randomized controlled trials or your own research or just dealing with patients, we have what we would call forms, but basically they're questionnaires. A form is a type of questionnaire where you're saying, right, I'm collecting specific information about a particular topic. Okay, so what we're going to deal with today are questionnaires and not surveys. If you're really interested in surveys, you'll just have to talk to Ray and sort of twist her arm to do a talk on surveys in general. But today we'll just look at questionnaires in particular. Okay, so this is the first one where you can take out your phone or click on the link, whichever you prefer. Question 1 is what bugs you about questionnaires, or you can type it in the chat as well. I'm the worst person in the world to send a questionnaire to. I spend my time going through it going, oh, that's wrong, that's wrong. Oh, they shouldn't have asked that way. Yeah, repetitiveness. Only one response submitted, so it's not going to really show up much. Yeah, questions that you actually have to have a spelling errors. Yes. All of these things are good. Yes, too long is a big one as well. Oh, look at that. Unclear. That word cloud does not look good. Let me just go with all responses. That makes it easier. Okay, so these are common problems with questionnaires, that they're too long and it's hard to interpret what exactly has been looked for, and you spend your time trying to decide what the hell is going on here rather than what you really want to find out. Have you seen any good questionnaires? And what have you found that's pretty good in a questionnaire? Okay, now let's go with all responses again. I don't know why it's slipped over. No, well, that probably means that, yeah, besides short and precise, which is good, easy to understand and fill in are always good things. And that's kind of one of the things that you need to remember when you're doing your own questionnaires is your own experience with them and trying to make sure that you don't replicate the bad ones, that you're only replicating the good ones. That's just some bump on that in case things didn't work. So a questionnaire then is simply, just as a definition while we get started, is a series of questions and responses, which people often forget, that it's both the questions and responses designed to collect accurate information. And in order to do that, we tend to have the principles of research design, which are these 6 things. And the first and most important one is remembering who your respondents are. That is fundamental to any questionnaire. Who are your potential respondents? What are your objectives in collecting this data? And then after that, you think about things like the types of questionnaire, the questions and responses, the layout. So all those things that we usually, when we design, well, when people sort of design questionnaires, they start at the questions and responses and work backwards. You actually need to start with who are the respondents and your objectives, and then go on to all the questions. And the last step there, part 6, which people forget about a lot, is you need to pre-test and pilot your questionnaire. No matter what, no matter how simple you think it is, you always need to do some pre-testing and piloting. Okay, so just sort of as a visual of that, that's really what I'm going to go through today. Is we'll start off with respondents, who are the base. If you don't figure out who your respondents are, you're going to be pretty stuck. You need to figure out what your objectives are, and then you worry about the questionnaire itself. There is a trade-off between all of these things, by the way. Depending on who your respondents are, will affect what objectives you can have. And as a result of that, what your objectives are and your respondents are, that will affect the whole layout and the style of questions and the type of questionnaire you use. There is a saying in questionnaire design that there's no such thing as a perfect questionnaire. It's just a series of trade-offs, and that's really what it comes down to in the end. All right, so to put some of this into practice, let's go with another question. You don't have to give an accurate answer to this one if you don't want to, either in the chat or online. But, you know, you can put in someone else's.
Oh my goodness, what are they doing? Did you say that?
Okay, so we've got married, de facto, married, single, etc. Okay, excellent. So you all read the question very, very carefully? Did you? You did, and you answered it appropriately? You think you did anyway? All right, someone got it. It actually asks you, what is your marital status? This one comes from my own experience. We were doing a huge questionnaire. I originally come from Ireland, as if you hadn't guessed, some of you. And we were doing a huge questionnaire. It was going out to every household in the country. And it had gone through, I don't know how many rounds of proofreading, testing, making sure that everything, you know, the boxes lined up. This was before it was internet-based. It was all paper-based. And the proof had come back from the printer, so it was all ready to go. And someone else who had never seen it before looked at it and went, why are you asking people for their marital status? So people pick those things up. You mightn't have today, but when people get questionnaires to pick them up, I kind of have to be careful. All right. So yes, so the correct answers are things like you're currently serving, or you're in the reserves, or you're a ninja, or whatever you happen to be. It's probably a better approach to your marital status. Pre-testing. Don't skip this. I put this at the very beginning because people get bored in these things. Well, no, you won't get bored today, but you know, you might, or you might just try to skip to the end of the video. And it is worth emphasizing all the time. You must pre-test. You must pre-test. Multiple drafts, whatever it takes. Test again, give it to your housemate, give it to your, you know, children, give it to your parents, get them to fill in the questionnaire and see if they get it right and what feedback they have for you on the questionnaire. Because it is interesting what people see in questionnaires. And you do need to make sure that it works for the population. The last part then is piloting, and piloting a questionnaire is always on a sample of the people you want as respondents. So you pick 5 or so people, maybe 10, depending on it, and you get them to fill it in and give you feedback on the questionnaire as well. So it is a bit of a process to do that, but it is well worthwhile. Okay, so respondents, any questions so far? I need to stop because otherwise you might think that I'm just yabbering on. All right.
Can I just say, Michael, as a comment, just to add something, I guess from a ethics standpoint, because some people may know me from ethics, but you know, a lot of times we found that these questionnaires that weren't being pre-tested were not appropriate for their audience in terms of being members of the general public generally, and there were a lot of academic jargon and things like that. So it is really important to pre-test. I absolutely 100% agree, because you'll have people tell you, I don't understand what that word means, or I'm not quite sure what you're asking here. So I just thought I would add that from my perspective, but yeah.
Yep. Raja?
I was just wondering what would be a good enough trial of pretesting, like this pretesting. I mean, how many should be enough to give it an understanding that we have tried enough, and now we should.
No, there isn't any definitive you have to do so many, but you do have to. The first one is to give it to people who you know are a bit critical, colleagues or whatever, and get them to have a look. That's always the first step. You can then give it to anyone you want, you know, some random person on the street, if that's good enough and you can actually get them to stop for long enough. You can get them to test it as well, but you still need, it's usually recommended between 5 and 10 people from the population that you are looking at, that they fill it in, and that you then ask them afterwards why they answered questions in a certain way.
And if you say, like, we are designing a questionnaire for a particular age group, so this pre-testing, do you think you will try other age groups as well, or just that age group?
You have to, it depends on the age group, of course, but approximately a similar age group is always a good idea, as close to as possible. You might find after you've piloted it with 2 or 3 people that they don't really have any concerns, which is a cross your fingers and hope for, and then that may be enough. You might be satisfied with that, but you know, it depends. It really does. Okay. All right. So respondents, then you really need to look at the world from the respondent's perspective, not yours. This is a little bit more difficult than it seems, but that's the sort of area that you have to look for, because you don't want to impose what you know or think you know, or how you communicate with colleagues or whatever on the participants, because they're different. They're not you. That's why you're asking them the questions. And secondly, you have to ask questions that your respondents, whoever they are, can answer accurately and completely. Okay, and I'll have examples later where, you know, you won't be able to do that, but that's what you have to do. Do the respondents have the knowledge you're looking for? That's sort of kind of a major aspect. So if they don't have the knowledge, then you can't really ask them for that knowledge. And the way to do that is through things like filter questions and wording to remove people who can't supply the knowledge that you're looking for. Can the respondents remember what you're asking? That becomes a big one in a lot of questionnaires, because if you're dealing with much older people, they may not be able to remember. And you may have to add in additional prompts to help people to remember. And if you're dealing with people where English isn't their first language, you have to remember things like, can the respondents express themselves in the questionnaire in the way that you are asking the questions? So do they have the knowledge to do that? Have they got the language skills? Okay. And this is why with that one, you'll always see for federal government that they will supply questionnaires in several different languages. And so will the ABS from time to time, to get over that problem so that people can actually express what they need to. Always remember, and it came up at the very beginning, that respondents, and you know this, you've got limited time, motivation, and patience to actually be bothered answering any particular questionnaire. It does depend a bit on context as well, because if you're filling in say you're going for surgery and you're filling in a form, you will have lots of time, lots of motivation, and lots of patience to make sure you get your information right. But just think about questionnaires where people don't, they're doing it because they want to help you out. And so they're going to be, they wanted this ordeal to be over as quick as possible. So you have to think of things that way. So how much effort will a respondent spend on a questionnaire? There are some sort of minor guidelines on that. And again, it does depend. But on face-to-face, stopping you walking down the street sort of things where people ask you questions, about a minute. And then they're heading off because they're much more important things to do. On the telephone, about 5 minutes. A paper questionnaire, about 10 minutes. So there isn't an awful lot of time to get your questions in there. And you really need to make sure that you understand that the respondents don't want to spend time on this. No matter how important you think it is, it doesn't matter. When questionnaires get too long or they're not legitimate and people don't really want to answer them, they will stop answering it. Okay, they just abandon the questionnaire, and you see that a lot online questionnaires where people start them and they never actually finish them because they just go, oh, I've had enough of that now. As a rule of thumb, and people often think I'm kidding when I say this, but I am seriously not kidding. You have to pretend that your typical respondent is a very distracted 12-year-old. Or even younger. Okay. And it doesn't matter who the person is or who your potential respondents are. If your potential respondents are PhDs, treat them as if they're a distracted 12-year-old. If your respondents are going to be clinicians, treat them as if they're, you get the drift. That's the level of attention that people want to give to questionnaires. Okay, so you have to use plain, simple language, no buzzwords, no jargon, as simple as you can. One of the things you can do is you can explain things before you ask the question so that your respondent knows what you're looking for. So you don't dive straight into the question, you explain what the question is, what you're looking for, why you're asking the question. Repeat questionnaire and question instructions. Do this ad infinitum if you have to, because if you repeat instructions, people will just skip over them if they already understand them. But if they don't understand them, then it's already there for them to get an idea of what you're looking for. So you just repeat it. If most questionnaires now are done online, lots still done on paper, but it doesn't really cost any effort to repeat these things like instructions. Use easy to understand questions. So keep your questions short and relatively simple so that people can actually answer them. The longer they are, the harder it is. So you may have to break some things down into several questions just to get the full answer. Remember, easy to understand responses as well. So a lot of effort tends to be put into the questions and very little effort into what are the potential responses, but the responses are just as important as the questions because people have to understand them and why you're asking and what they equate to. None of this is dumbing things down. It is just trying to make sure that things are so simple and so straightforward for the respondent that they will actually answer your questionnaire and that they'll be reasonably happy to do so as well. Okay, so the curve, I was going to say a big word there, but I can't even get it out of my mouth at the moment. So the opposite of that is, lots of people tend to start out with open-ended questions. So these are what are called open-ended or unstructured questions where, type into the box, like the questions I did at the start there, but they're not a questionnaire, so I'm allowed to break the rules. Unstructured and open questions are very hard for people to actually answer. You're putting extra cognitive load on them to answer those questions. Okay. Complex questions and responses and complex choices, again, as I said earlier, you need to break it down into simpler ways of that people can understand. And lastly, because some of you have said it as well, having long questionnaires and you're sort of losing the will to live as you go through the questionnaire is a bad idea too. So this is where your objectives come in, and you really have to understand that, are these questions matching my objectives? If a question isn't there to help with an objective, then it's irrelevant and should be taken out. There should be no nice to know questions. It's either relevant or it's not. And if it's not relevant, you just go, yeah, don't need that. Okay, so that's respondents. Anyone with any questions so far? Yes, Raja, sorry.
Hey, Michael, just like sometimes, I see these questions which doesn't actually address the or ask the actual problem, but just to ensure that the person is understanding and actually engaging in the questionnaire completion. So unrelated question, but so do you think that those are important?
It kind of depends on what you really mean. I'm not trying to be obtuse here. There are instances where you will put in questionnaires, you will put in particular questions to ensure that people, I just say, are answering as truthfully as possible.
Yeah.
And that is done, and it does depend on the questionnaire. Yes, so that they're fine because they usually are part of the objective of ensuring that you're getting accurate and complete information.
Yeah.
Okay, so moving on to objectives then. So what are your research or information objectives? Why are you doing this? You need to have a clear set of why the information is needed that you're asking for. And one of the things to ask yourself as well is this information available anywhere else? So if it's available through something like patient records or the Australian Bureau of Statistics or the Australian, Health and Welfare, whoever they are, can't think of their name, someone will tell me. If the information is already available through them, then why are you doing yet another questionnaire? So you do have to have that as a reasoning behind it. Each question must answer or contribute to your objectives. Okay, what I do on this one is, when I'm designing questionnaires, I literally write which objective each question is assigned to, so that I know exactly that I have assigned questions to objectives. And in that way, if I come across a question where it's not assigned to any objective, I can go, well, that's yet another one that can go. Or else my objectives aren't complete. So which is, so it does keep, it keeps you honest. It keeps you sort of on track and honest about the whole thing. And what this sort of relates to what Raj was saying as well is that, and this is complicated and I'm not going to get into it too much because it is a major topic, is this just a general questionnaire to get information from people for just a particular, you know, one-off or ad hoc or whatever, or one particular research project? Or are you using this questionnaire as a long-term collection of data on participants or patients or clinicians or whoever the population is? If you're designing this thing for long-term or to collect information repeatedly on different people and to try and compare it all together over time, then what you're actually creating is called a measurement instrument, which is a very psychology way of saying it. But what you're doing is you're creating something different to a standard questionnaire, and it requires far more testing and far more understanding to do that than it does to create sort of a one-off or will be used a few times questionnaire. Okay, so an example of this, which is of this, is things like they're used in clinical work the whole time. So I know psychology ones because background, you know, things like the K10 for depression and whatever, they're measurement instruments. They've been tested and tested and tested to make sure that they give accurate results for people. So you have to be very careful on that one. I'm not going to get into designing measurement instruments. That's definitely for another day. And measurement instruments definitely need reliability and validity testing. Some questionnaires do as well, but not all of them. It really does depend. You're getting into more complex territory there as well. Again, remembering that respondents have a limited time, motivation, and patience. So although you may have a long string of objectives that you want to have answers to, that doesn't mean that your respondents have a long string of time to answer all of your objectives. So you do have to balance those things out. Remember, I said it was sort of, there's a tension, a give and take there the whole time. Okay, so next we'll be getting on to types of questionnaire. I'll keep going and then I'll stop after this one because it gets into sort of the more nuts and bolts after this. A questionnaire, another way of saying it, it's a highly structured interview. So questions, when they're put on a questionnaire, you can't explain them to people once you've put them on the questionnaire. They have to be self-explanatory, and they have to include all the information that's required. Okay. Telephone questionnaires, as I said earlier as well, they need to be short, simple, straightforward. There's a huge non-response. I doubt if anyone here is ever going to do a telephone questionnaire. I think the response for telephone questionnaires at the moment is something around 2%. It is absolutely almost below, not even considering anymore. Self-administered questionnaires are the ones you get in the mail or online, mostly online these days, of course. And it's easier, as I said as well, I'm repeating myself a bit here, it's easier to give detailed instructions. You can have simple, but you can have a little bit more complex questions and responses too. And especially online, you can do things like having what are called skip logic and branching, which allow you, if a participant indicates You know, say you ask them, do they smoke? And if they don't smoke, you can skip a whole heap of questions that are related to smoking, and you can go on to ones that relate to other things, so that you can skip through all the things that participants don't really want to give an answer about or don't have the information. Face-to-face or in person, via video, whatever questionnaires, again, you can, in theory, ask longer and more complex questions, but that's longer and more complex from the respondent's point of view, not your point of view. So again, you have to think about your respondent, what they're capable of giving you. Face-to-face, you can also use things like prompt cards or props to help people understand the questions a bit more and to give responses as well. Okay. Any questions? Because we're moving on after this onto the actual questions and responses themselves. All right. Right. So based on your respondents and based on your objectives, how do you do all this? Remember, include instructions for the respondents on questions and responses. I know I'm repeating myself, but it's worthwhile. Should you use existing questionnaires? And the answer is a big resounding yes. Please use existing ones. That sort of quote there, semi-quote, is that, you know, that artists, good artists copy and excellent artists steal. Well, in questionnaire design, excellent questionnaire designers just steal the whole damn thing and copy. Because it's easier if you've got stuff that exists already than making it all up yourself. Consider two things in questions and responses. So the structure of the questions and responses and the wording. So these are two different things. One is how you structure your questions and the responses that are applied to them. And then you have to consider the overall wording of both the questions and the responses. So it's usually at this point, it's probably usually a bit later. I should have put this one in probably earlier, is about there is a thing about the validity and reliability of questionnaires and the questions that they contain. I could have put this in before when I talked about psychometrics. You may have heard of these terms. I'm not too sure. Validity is usually you may or may not have heard that it contains three things, which is content validity, concurrent validity, and construct validity. It's actually a lot of not correct stuff. Back in the mid-80s, which is quite a while ago at this stage, you're talking about 40 odd years ago, the American Psychological Association, along with the education department in the US, decided that there was only one type of validity, and that was construct validity. Yet everyone has three. I don't know. You know, people are slow to learn. Constructs, anything that's a construct is something that can't be directly measured. Okay, so anything that goes on inside a person's brain can't be measured, so therefore it's a construct. Okay, and validity always is three things. So the theory that the questions were developed around, the evidence for how the results can be interpreted, and the stated context for the use of the instrument and results. All right, which is all very complicated, but it's easy to understand from this point of view. The government does NAPLAN every year for years to 3, 5, and 7, or 5, 7, and 9, or something like that. But it's odd years, or even something along those lines. One of the big things for why NAPLAN shouldn't be used is that it wasn't developed for the purpose that the government uses it for. It's developed so that it was developed, the actual instrument itself was developed so that teachers could understand the progress that individual students were making. And therefore they could change their teaching methods and styles for individual students in order to help them. But it's been used as a method to see if the population of students are improving or not. And this is why there's always the controversy about NAPLAN, or there was. Sort of died down a fair bit, but it comes up every now and again. Another example is the aged care algorithm that's been used by the Department of blah, blah, whatever it is, Commonwealth Department of. And even the person who developed that algorithm has stated that they are not using it the way it was developed. And it hasn't been tested in the way that it has been used. And shouldn't be used as a result. So basically that algorithm is an amalgam of about 12 different measurement instruments put together, hoping to get a score at the end that says whether aged care people with needing assistance, what level of assistance they need and should get. But no testing to make sure that it actually works, which is always a bit of a problem. Reliability then is a part of validity, as in it is a sub part of it, of validity. And it's about having consistent reproducible results across time, question items, and different raters and different people who answer. So that's validity and reliability. And I've no idea why it got stuck in there rather than a little bit earlier. It's some background for you. Any questions on validity and reliability? I hope not. It's hard. All right, so types of questions, right. So dichotomous questions in the name have possibility of basically two answers. They're yes, no questions, true, false, you agree, you disagree. It also covers things that have a third option, which it tends to be, I don't know, or I don't care, or it's not applicable to me. They're still considered dichotomous questions because you as the questionnaire designer are really looking for yes, no answers, and the respondent can also answer whatever, okay? And the advantage of these are that they're really, really easy to write. They're easy to answer. Used a lot for skip logic. You know, are you over 18? Yes, no. If you are over 18, continue through the questionnaire. If you're not, don't bother. They're, as I said, very simple to analyze. Unfortunately, they collect very little information. What does it really matter if someone is over or under 18, except from the point of view of whether they should be included in the questionnaire or not? So you're getting very limited information. One thing that always comes up on these things is that the questions are susceptible to the wording influence, but basically every single question is subject to wording influence. So I don't know why that's put up as a disadvantage ever. It's a disadvantage of every single question that you've ever been asked. Okay, so they're dichotomous. The next most simple kind of questions are multiple choice. Please tick one. You've been asked these 1,000,001 times. So there are problems with a lot of these questions, and you will be asked to show what they are later. So I won't talk about it now, but I will talk about it later. So please tick one. You know, what was your last sports injury or other, please specify. Always a good idea to put in an other category because often you don't cover everything. And another category then captures the rest of it. Again, they're easy to answer. They're very simple to analyze. They're very good, again, as well for filter logic for filtering, skipping, branching. So if someone has a head injury, you can ask a whole heap of questions about head injuries. If someone has a neck injury, you can ask a whole heap of questions about a neck injury, but you don't necessarily have to ask the person, the two different people with two different injuries, the exact same questions. These do have an ordering or position bias. And that's one of the things that gets analyzed in some large-scale questionnaires is there a lot of people ticking head and neck because they appear first, or not, as the case may be. And what you'll have is in a lot of online questionnaires, the order of these things is randomly assigned every time a person answers the question to try and get rid of that order bias. Next type are multiple answer questions. So this is where you tick as many as apply. And they're basically analyzed as a series of yes/no questions. So you're basically asking, do you have a head injury? Did you have a neck injury? Did you have a back injury? So it's a series of yes/no. Again, pretty easy to analyze. They give you a little bit of information, but an awful lot. And you know, they're fine, and sometimes they're required, and that's fine too, because you want people to tick as many as apply, and there's nothing wrong with that. Rank order scales are the next type, and these are rank things from 1 through to 5, etc., etc., etc. There's a lot of respondent error with these sort of things. Especially in write it down type questionnaires, but on online questionnaires, it's a bit easier to rank things because you can drag them around and make changes, which is not possible to do otherwise. But they're rank order scales. Then you get visual scales, visual rating scales. Everyone loves a good VAS, visual analog scale. Don't use a visual analog scale in your questionnaire. It's almost impossible to analyze. And if it's on a piece of paper, you have to take out a measuring tape and all sorts of crap. It's just ridiculous. So don't use it. Go discrete instead and get people to just put a number in from 0 to 10. So how much pain did you feel? 0 is no pain, to 10 being the worst possible pain imaginable, which we've all been asked or asked of others from time to time. So I don't know why people bother with the visual analog scale anymore. There are things like the Wong-Baker scale, basis scale, which I love. These, especially these are used in pediatrics. There is a version of them as well for people who don't have, say, English as a first language, so they don't understand the question and they can point to the correct answer. So you can do lots of them as well. This one is called an adjectival scale. This is where it starts to get a little bit more difficult. And it's all of these questions that start at one end and finish at another. So like most pleasant to most unpleasant, or very important to very unimportant, strongly agree to strongly disagree, etc., etc. They're called adjectival scales. One thing on these is that whether it has a middle point or not. Okay, so this one here, sorry, pen. So this one here has a middle point. This one here has a middle point. This one here doesn't have a middle point. And this one does have a middle point. You do have to be careful sometimes with middle points, because if people are a bit wishy-washy, or you believe they will be, then they're going to choose the middle point. If you want people to land on one side of the divide or the other, then you need to ask questions without a middle point. It's a bit of a personal call on these things. I did a questionnaire once where I put in a middle point, but everyone was very wishy-washy. And the number of people who put in the middle point just made the whole thing ridiculous. So yeah, not good. But you know, you get that. Live and learn. Right. The other type of...
Hey, Michael.
Yes?
I've got a question about that one. If you go back one slide. Oh, maybe it's here. My question was on your other slide, you mean this is just an example about the adjectival scale. On the next slide, you have all of the words across all of the tick boxes, right? So you've labeled every box. Yeah. What do you think is the best way to do it? Do you think labeling everyone, or do you think labeling the polls and maybe the one in the middle, if you do the one in the middle? What are your thoughts on that?
With adjectival scales like the ones on the current slide there, I tend to just label the first, the middle, and the end one, because people then can make up their own minds what everything else means. Then you can have ones like at the end here of don't know or doesn't apply to me or whatever. I tend to go with that. Sometimes it's really hard to come up with a decent middle word.
It is. It really is sometimes.
Like, so excellent, average. So what do you put in there? Good? Is good somewhere between average and excellent? Or do you want to put in very good? So it does mean that you don't have to think about it too much. And you can let the person decide what the middle one means. On the other hand, this is a Likert scale, or if you've got a German-speaking background, this is a Likert scale, because he was German and he called himself Likert, but whatever. Likert scales are different to adjectival scales. There's a few things. One is that they always have to have a neutral, and they always have to have a strongly agree to a strongly disagree, or a very important to a very unimportant. So, okay. They can have between 5 and 7 steps in between, but must have a neutral. All the questions have to be related to each other, because the good thing about a Likert scale is that you can add up all the answers and get a score for all of those questions that were asked. And that gives you far more discrimination in what people think than a simple 1 to 5 or whatever. Okay. So a Likert scale is designed that you can add everything up, whereas adjectival scales, you can't, because they're about different things. All right, so all of these questions, for example, here are about work, basically. Now, are they about work in a way that would satisfy a psychometric test? No, they're not. But at least they're all related to one concept that's called work. Okay. All right, let's take a break. How many ways can you ask the same question? Right. How often do you exercise? What are the potential responses that you should put in there? And you can answer in chat if you want to, or you can put your hand up and just shout at me. I'm happy for you to do that too.
I suppose you could do a scale, Michael, of like
you can,
1 to 5, or how many days in a week, 1 to 7, something like that. Or I've seen it a few times where they say 0, 1 to 2, 3 to 5, those kind of things.
All right. Yeah, absolutely. So one is, since we've got one, times per week is, write in the hours per week. What is the problem with asking people to do that? Someone that isn't Helen or Ray or Raj, for that matter. I'm not just picking on you guys, but you have. Yes. So as Bronwyn says, they guess. Yeah. I'm getting to that.
Here they come.
Yes. Yeah. Thanks, Lucy. That's exactly it. Yeah. Bree is right. What is exercise? And yes, Francis, people definitely overestimate when you allow them to put anything in. Look, that is the problem there. When you allow people to put in anything, they will put in anything. Okay. An alternative way to do it is to have something like regularly, occasionally. So that's basically a yes, no. It's a dichotomous answer. Again, it's not really telling you much, is it? You know, what is regularly? So regular exercise for my partner is at least every day. Regular exercise for me is, well, I got off the couch yesterday, so I'm good. So it doesn't really tell you anything. A better one is something like that. You know, twice a week or more often, once a week, less than once a week. But again, that doesn't really cover everything. So you then move on to something like, how about this? Is there any problems with this? Is this better? If anyone sees a problem with it, with this one, they'll get a gold star. It's in the mail.
What about never?
What about never? Yep. All right, so maybe a never should be put at the very end. All right, too many options. Yes, you could say that. I agree with Francis. There may be too many options in there. Less than once a week is there. What is less than once a week? Well, that's, you know, once every 2 weeks, you know, once every 10 days. It's a bit vague, absolutely. Maybe it differs from week to week. Yeah, absolutely. All right, all right, we'll look at this one. It is easier to analyze, and it is correct, Lucy. Yeah, it doesn't cover all objects. Yeah, and definitely it depends on your objectives. Right, if I gave this question to professional athletes, is it a good question? Hell no. If you're a professional athlete, you're probably doing training sessions twice a week. Sorry, twice a week, twice a day is what I meant. You know, most professional athletes will do 2 exercise sessions, whether, you know, one is aerobic and one is strength training every day. They may get 1 or a half a day off a week. So for a professional athlete, this is a ridiculous question. For someone who is 10 years of age, does it even make sense to ask that? So it does depend on your objective and who your audience is. So people who thought that or who wrote it, gold stars. How about this one? How do you ask someone's age? Because it's always a bit contentious. I have seen it as, what is your age in years? Does everyone know their age in years? I must admit that I often or fairly regularly have to pause for quite a while to figure it out. How about what's your date of birth? Does that work? Is that easier to remember than your actual years? People, yes, people lie. The other thing with this one is if you ask the date of birth, people put years, months, and days all in different orders. And you have no idea whether they have or not. It is sometimes pretty easy to figure out because you know that there's only 12 months in a year. But sometimes it can be hard. How about a question with, now, if this was online, you'd have little dials so that people could choose, you know, the day, the month, and the year. Does that work? Again, people lie. You'd be surprised. I always lie, not on official questionnaires, but you know when you have to sign up to a website and they always want your date of birth? I always lie. I never give them my correct date of birth because I don't want them to have it.
I'll tell you what I hate is those scrolly wheel things. We have to scroll for ages, and it makes you feel really old because you're scrolling all the way to the end.
Yeah. Absolutely. Yes. All right. That is actually a really good way if you actually need someone's day, month, and year of birth. But do you really need it? So what you can ask is something more like that. Because you generally only want people's category. You only want them within a certain sort of limits. And that's much easier to fill in and much less likely that someone will lie about it as well because they're putting in a range. Yes, Ray.
Some people would be told that it's better to collect as much as you possibly can, and this is a point of that, than not. What are your thoughts on that?
All right, I say you gather as much as you can, but you also have to balance that with the likelihood that people will either not answer the question or answer the question inaccurately. If you're only going to analyze the data based on age groups of 10 years or 5 years, by the way, the Australian Bureau of Statistics does this on 5-year blocks the whole way through. And if you're doing things that you want to then cross-match with other research or what the Bureau of Statistics have done, then you should do it that way. But otherwise, if you're only going to analyze your data based on age blocks, then that's what you ask. You don't ask for people's actual age because you're never going to use it. Okay, so you have to balance the two up. Okay, anyone want to spot the error that's in the right-hand column? It's not so much an error, but it's a, huh?
So what happens between 39 and 40? Like, or
no, well, that's in there. So you've got 22 to 29, then you've got 30 to 39, 40 to 49. It's at the very beginning.
Is it because you're asking about 18 to 21 and is a smaller year set? Is that something to do with it?
Yeah, so you have to kind of ask, yeah, so, and Bree has put it in as well, and so has Bronwyn, so thank you very much. Yeah, so why am I asking for 18 to 21, 22 to 29, and then in 10-year blocks after that? It's a little bit inconsistent. Now, there could be a really good reason. If, say, for example, you're doing research with people who are around that, you know, in that sort of late, you know, under 18s up to mid 20s sort of thing. But then if that's the case, why are you asking whether people are 70 or above? So it's very inconsistent in why you might be splitting things up that way. You know, if this is really aimed at people in their 20s, then you'd have a 30 plus age group that you would all just bang together, or you'd say, you know, if you put in 30 plus, just go away, don't answer the rest. So you do need that consistency in there. All right, time is moving on. And I'm still waffling away. Wording. Wording is really, really hard. And this is where you have to ask lots of questions about simple words, unambiguous, use conversational language. Don't use the language you use in a clinic. And amongst clinicians or amongst other people, colleagues, use the language that people themselves use. You have to make sure that you get rid of all of those, you know, jargony phrases, explain things, because sometimes people don't know. Let's get on with the first one. Why are they not good? I did say that I'd get back to you on this one. Why is the wording in these not good? And I haven't put in my famous joke that I put in everywhere, which is, what do you mean by sports? What do you mean by an injury? And what do you mean by head? And what do you mean by neck? Isn't neck part of your head? Or is it? You know, I'm not an anatomist. I'm Joe Blow from down the street. What is the back? Isn't your neck your back? Or is it? So it just seems like bizarre kind of categories. So you can make it better by going, right, so what about this? Head or neck, back, shoulder, hip, arm, elbow, wrist, or hand, knee, leg, blah, 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 blah. Is that any better? Maybe. Again, it will depend on respondents. It will depend on objectives. So the thing is, you have to think about it. You have to understand and make sure that, yes, these categories, the way I've done it is what I'm looking for, rather than it's just what I thought up at midnight with a glass of red wine. So you do have to, and as Lucy said, even better is have a little diagram. Let's pretend that this is actually for kids and have a little diagram, and they can click. They had really, really injured their hair yesterday. Or their toenail or whatever. But it gives, why not give a diagram so people can associate the different body parts to what you're asking them to include. Okay. So again, remembering the audience, who are the respondents? What are they likely to be able to figure out and not figure out? Wording. I've got lots and lots of ones that ask different questions. All right, so you're a physiotherapist working in, on the wards, and you ask a patient in one of your questionnaires, in the past 66 hours, have you expectorated purulent sputum? What the? I know what that patient will do to you. Won't be pleasant. Okay, and why 66 hours? How long can people actually remember? How far back can people remember? Okay, for something like this, 24 hours, 12 hours? Will they remember back any further than that? Probably not. I've seen questionnaires that have asked, in the last 6 months, I don't remember yesterday. How the hell am I going to remember 6 months ago? Okay, so you do have to worry about times as well. Do you like the atmosphere and service delivery? Yes, I like that. If you have to Google a question, you've done it wrong. What's wrong with that question? What happens if you went, sorry, yeah.
I kind of think we all like the atmosphere at some point in time. I mean,
yes.
What we breathe, or is it not? I mean, it might be too broad.
Yeah, it's sort of vague, but say you went to a restaurant and at the end of your time there, they gave you a questionnaire and said, could you just fill this out before you leave? We'll give you 5% off your meal. You go, absolutely. One moment, please. But what if you liked the atmosphere, but the service delivery was crap? How do you answer that question? So that's what's called a double-barreled question. It's asking you two things in one question. And nearly every question with an and in it can be separated into two separate questions. Not always, but vast majority of the time. What pain relief did you use? Several problems with that one. I'm sure you can think of at least 2 problems with it. The pharmacists out there and clinicians will be saying, you can't use the bloody brand names, you have to use the drug names. Thanks, Denise. But do your patients understand the difference between brand names and drug names? Maybe, but will they be able to write the difference or tick a box the difference? What if you used both? Because you can actually get both in one tablet now. So it's not asking, there should be an other in there, there should be something else in there. It's just, it's way too narrow. So you haven't, what's that's called is you haven't, what's the word? I can't think of the word right now. It's why you put in an other category so that people can use something else, say something else, or yes, as Ray said, what if you used heat or ice or something? So maybe you want to put those in as well as other. Okay. They need to be exclusive and, oh, sorry. Where did you grow up? Country, farm, city? What happens if you grew up in the country and on a farm? What happens if you grew up on a farm and in the city? There are some city farms still, not many, but there's still a few. What if you grew up on the beach, which would be much nicer? All right, so again, there needs to be another category in there that says other, at least one other category in there. I like this one. Okay, so this is a leading question, Your Honor. Objection. Okay. You'd want to be pretty, yeah. You'd want to be pretty heroic to say no to that one, especially if it's a health worker handing you the questionnaire.
And you hadn't finished your treatment.
Yeah. And I haven't given you your clothes back yet.
Ooh, nasty.
What do you know about stars? And yes, Bronwyn, it is confusing to put in negatives in a sentence. You try not to do that. You try to, because people do have problems with negatives. But I like the way you stated the question as, isn't it also confusing? So what does anyone know about SARS? What is SARS? Bree is correct, it's jargon. SARS is severe acute respiratory syndrome. So, but SARS is also a tasty drink. It's short for sarsaparilla. So you have to Sunday afternoon relaxation session. Excellent. Yes, so don't use acronyms. Really, really don't. Because yeah, nobody knows what they mean. As I complain regularly to anyone who listens, I've got a background in about 4 different disciplines, and they all have their own acronyms, and they all overlap and all mean different things. So I always just don't use acronyms with me because I'll probably misunderstand what you're saying. How about this one? Okay, yeah, sure. Yeah. Again, leading question, Your Honor. Here's some more. This goes back to Bronwyn's one. Isn't it a good idea to not turn reports in on time? That That's where, yes, too many negatives make it very, 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 very hard for people to understand. Sure, of course I do if health professionals say so. Unless they're talking about vaccines and then they're wrong. I got that from G5 or something. I don't know. How about this one? Okay, so that one is assumed knowledge. You're assuming that people know about the Centrelink changes. Not that there are, by the way, for anyone who's interested. There are no Centrelink changes happening as far as I'm concerned or know about. But that's where you would have a little sentence saying, so the government is proposing that, yada, 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 yada. What is your opinion on? And that means that, yeah, Helen?
I was just wondering if it was part of your objective to know if people are hearing about certain things in the news or whatever, could you use a question like that if you're trying to sort of figure out if people are understanding those sorts of things?
Absolutely.
That makes sense.
It does make sense. That does happen a lot in, say, market research, where you'll ask people, for example, to list a whole heap of, list the soft drinks, that are available generally, and then you'll have a follow-up questions about, have you heard about this one? So it does both, right?
And can I ask, and it goes back to Helen's comment about when she saw the question about what's your opinion of the Centrelink changes, she asked if it was okay if you wanted them to understand whether or not people knew about it. But knowing and your opinion are two different things.
Are two different things, yes.
So the question might then be, Helen, do you know about? Or something like that.
Yeah.
So it goes back to always links back to your objectives. What are you trying to find out?
Yeah. Good catch. See, got it wrong. Greg got it right. How about this one? Any particular problems? Yeah, Denise got it right. Overlapping, well, it's not so much overlapping as a gap. What happens if you worked for 2.5, 2? There is, yeah. If I'm dead on 2 years, do I answer A or B? Which one do I answer? All right, so that should say 3. Whoa, that's a very bad 3, but that should say 3 there. Looks more like a worm that escaped. Do you use social media? Yes, no, sometimes. Just a waste of a question. Really, it should be, how often do you use social media? And then with different categories.
I really like Samantha's comment though.
Sometimes is yes. Sometimes is yes. Okay, Raj, 2.5. Well, 2.5. I was wrong with that. 2.5 years goes into 2 to 5 years. But yeah, if you're 2 years working in health, you've got the overlap. All right. Some questionnaire layout. This isn't necessarily as important as it once was. Well, it's still important, but since most things get done online, the software will do it for you. And it will, in general, do a reasonable job. Said he, having doubts about that. The order of questions, you start off with filter questions. So all those things like, are you over 18? Do you smoke? Do you drink? Whatever, because you don't want to waste people's time. So people who aren't eligible, you can then kick them out and say, thank you very much for participating. But we don't need that. Your opening questions should, in general, be something interesting, simple, non-threatening. Ones that, these are literally what I would call tick and flick questions, which comes from paper days. where you just went tick, 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 flip over the page, tick, 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 so that you don't really have to think about it. The bulk of your questions need to be in a logical order for the participant, not for you or your objectives. All right, so a lot of the time your objectives are in a certain order, but the questions will be in a completely different order because they have to be in order for the respondent. You don't want to be skipping around the place. Again, reducing cognitive load, I think, is the phrase that's used in psychology a lot. Anyway, and then near the end, because you have people have answered all the questions and they're near the end, you can then ask some of the more difficult ones because they're more likely to answer them because they are the last few questions. Okay, that's called the foot in the door technique. In other words, when someone is already there, then you can ask them something a bit harder. Will they answer? But it's more likely. Okay. Remember that you should use a funnel technique as well. Start from things that are general and then work your way into things that are more specific. Again, that just helps people deciding and understanding what's happening. And again, using branching or skip logic, because I did say that as well earlier. Questionnaire format. Yes, first impressions do matter in this. If a questionnaires, sorry, okay, so Lucy, what do I mean by skip logic? So if you have, I have used it as examples as I've gone. So skip logic is things like, you know, what, where was your latest injury, head, neck, whatever. So a skip logic is if someone ticks head, then you can skip to all the head questions. And you don't have to ask people all the neck, back, arm, elbow questions. So that's what skip logic is. It means you can just literally skip all the questions that don't matter to the person. No worries. Divide questions into sections or pages online so that, again, people have, there's nothing worse than on a questionnaire and you're starting to get bored. So you scroll and scroll and scroll and you see, oh my God, there's that many left. And then you give up. So divide it into sections so people can see that they're making progress, that this isn't going to happen ad infinitum. Number questions sequentially. Most software will do that anyway. Always include sections, instructions per section, per groups of questions, per question, and repeat as needed. There's no extra charge for electrons on a internet form. Yes, Ray.
I confess to having given up on surveys, like, you know, and that's a lot for me because, you know, I think people invest a lot of time. They want to know, you know, what you think about something, but to give up on something is a big deal. And mostly I give up because it's exactly your example. You go through and just go, this is taking forever. It is going on and on and on. What are your thoughts then of having a progress bar? You can do these on most of the online platforms. So what are your thoughts about a progress bar?
I don't mind a progress bar. As long as it's moving. Remember, online questionnaire, 10 minutes is about the max. So it's more about timing as well. If you've got 1,000,001 pages, a progress bar isn't actually going to move very much between each page. So you have to make sure that your progress shows actual, that you are getting to the end here. Okay, because otherwise psychologically it'll be, oh my God, no. If you're using a paper-based questionnaire, pre-code, that's putting little numbers beside all the options so that it's easier to type in the numbers into a spreadsheet or whatever. Have a code book. I'm not going to get into that because, but if you talk to me, I'll tell you about code books. Basically, it's an outline of what the questionnaire is, how people answer the questions, what everything means. Pre-testing, not to be skipped. Just remember, you do pre-test, you do pilot. Okay, here's some more examples of actual questions that have appeared on questionnaires. Number one is a doozy. Yeah, and 10 minutes later, you're still reading the question going, what? I don't know. Yeah. That question, as I say, actually appeared on the questionnaire. Yeah. What about this one? Again, an actual question. Again, although it doesn't exist, this is a double-barreled question. Not because there's an and, but because there's an or. And what do you mean by physical contact? Because yes, it does for particular physical contact. So how about this one? If I was asked that question, I'd give up already. I wouldn't be going past that question. Seriously. Yep. All sore throats are bad sore throats. All right. So look, you really have to be careful. You really have to be careful. Last one. Is this the same question? By the way, there's nothing wrong with either question. Okay, Ray says they're not the same. All right, so what it comes down to is persons your age versus in general. Okay, this is from the UK. It's a national survey on health, aging, whatever. Sorry, I don't mean that. Anyway, they used to ask for persons your age, and then they realized that, do you actually know people your age? Especially if you're elderly? How many people do you know who are actually your age? And people tend to just look at the extremes on this one of the people who are really unwell and the people who are really well for that age group. And so changing it to it in general makes the question more neutral in a way, and just ask them about if they feel that their health in general rather than in comparison. So the second one is a much more fair, unbiased question. Any of you developing your own questionnaires and want help? Ask. That's what we're here to do at TAAHC. So please do bring your questionnaire and I will have a look. And before everyone runs away, what do you think is the most important thing you learned today? How to design, cool. Food for thought, if nothing else.
Mm-hmm.
Okay, I do have, people have asked this in the past. They have asked me for survey platforms. The top ones there are ones that may or may not be available to you in your organization, depending. The questionnaire, the little questions that I put up on PowerPoint are all done through Microsoft Forms. Qualtrics may be available. REDCap is used especially for clinical research and for longitudinal research. There's a million and one other ones, and I couldn't say whether they are worthwhile or not. And I certainly wouldn't use them for health-related data. You have to be very careful with that. I do have references as well if you're interested. But otherwise, thank you very much for your listening to my blather on for an hour and a half.
Thanks heaps, Michael. If anybody wants any of the slides, perhaps we can PDF them and send them through. The recording of today's TAAHC Prac will be on the TAAHC YouTube site, probably in about 36 hours.